Um,
It is 12:30, so I would like to go ahead and get started if possible. Thank you everyone for coming and attending this event today. I'm excited to see some social work colleagues from University of Maryland Midtown campus as well in the chat, where I still PRN as a social worker sometimes. And for those of you who don't know me, my name is Heather Kangas. I'm a licensed clinical social worker with Maryland BHIPP. If you have called our consultation warm line before, you've likely talked to me. I've worked since October at the program, and I'm on the line 3.5 days a week. So it's very likely you've talked to me if you've ever used the warm line. So thank you very much. And this is being recorded, obviously, for those of you who just heard. So I want to go ahead and just go into some brief introductions, and then we'll get into a question and answer with our panelists. This is a little different than how we've been doing some of our resilience breaks. Usually, we kind of have a long PowerPoint presentation, but today it's going to be more of a conversation of sorts, which I think will be a really interesting format, and I'm really excited about that. So our topic today, I think, is really timely and relevant. It's on young adult perspectives, conversations about primary care and behavioral health. Obviously, I can't imagine being a young person today. Right now, as an adult, I feel overwhelmed by a lot of what's happening in the news just this past week. So I can only imagine what it's like for a young person, especially a young person who might be Black or from a marginalized community right now. So I feel like conversations like this are even more important to have right now, just because of all the things we're facing. So I feel really fortunate to have our panelists here. We have two really awesome panelists from Taking Flight, which is a youth peer support organization, part of Maryland Coalition of Families, and it is a youth move chapter as well. We have Haley Rizcala and Brendel Mitchell from Taking Flight here as our panelists. So we're really excited to have them here, and they'll be introducing themselves in a minute. I just wanted to quickly go over a couple of things. Please use the chat for any questions. We'll have a Q&A. That's going to be the majority of what we're doing today, but we'll go through some questions that are also generated from you all after as well. And then I just wanted to go through a little bit of who BHIPP is. If you're not aware, Maryland BHIPP, also known as Behavioral Health Integration in Pediatric Primary Care. We offer a lot of different services, including a physician consultation warm line, and we also offer social work co-location at primary care practices through Salisbury and Morgan State in Baltimore City and on the Eastern Shore in Frederick. We also do these resilience breaks, as well as have tele-echo clinics for our primary physicians, and soon to come, hopefully, some telepsychiatry and mental health. So I'm gonna actually stop sharing this file if possible, and see if we can just kind of go into a, oh, I'm so sorry. Oh my gosh, no. And see if we can just go into a conversation with just you all talking about a little bit more of us going, if you can introduce yourselves, and then we can go through some questions. So I'll let you all introduce yourselves a little bit further, since I only gave a really brief introduction. Thank you so much.
Thank you. And if you don't know about Maryland Coalition of Families, I'll offer a few details on that as well.
So MCF helps families who care for someone with behavioral health needs, and that can be mental health or substance use related. And our staff is made up of family peer support specialists who provide one-on-one support for parents and caregivers of young people with mental health challenges. And they also give support to any loved one, so a spouse, a sibling, a friend who is trying to support someone with a substance use or a problem gambling issue. And Maryland Coalition of Families saw that there really is a lack of community resources available to young adults. There are plenty of resources for children, and those don't really meet the needs of this population, and neither do the programs that are for older adults. So they created Taking Flight about 9 years ago. And over the past year, so Brendel and I joined in December of 2019. Over the past year, we've really been building off of what Taking Flight has done in the past, as well as expanding the program to meet the needs of the population today, because we have a very unique set of challenges in front of us right now. And we really do this through three main objectives. And the first is informal peer support. And, we really want to create a network of peers in Maryland so that, these young adults can get support from each other, even when they're not directly at a Taking Flight event. We also offer leadership development opportunities. This really plays into these young people, living independently for maybe the first time and having their health really be their own responsibility for maybe the first time. And so we try to foster as much trainings, we offer workshops. We want to really empower these young adults to take control of their lives and feel confident. And our third objective is involvement in advocacy. Brendel and I sit on several statewide behavioral health committees, and we're really there to provide the youth voice, the youth perspective. And we invite all of the young adults that are connected to Taking Flight to, give us their input. And we're happy to raise the concerns that they're feeling in these spaces where a lot of the policy directly affects young people, and usually we're the youngest person in the room. So that's a really great opportunity that we have as well. I'm happy to take more questions about Taking Flight at the end, but for now, I guess I'm Haley Rizcala. I am a senior youth engagement specialist with Taking Flight. I am 27 years old, and a bit of my lived experience. So we mentioned that one of our main priorities is to provide peer support. So what qualifies us for that job is that we each have our own lived experience with behavioral health challenges. And my experience is that I'm diagnosed with generalized anxiety disorder and depression. And I also am working through trauma that's related to having both of my parents have pretty severe mental health challenges and substance use disorders themselves. So that really inspires the work that I do. And also, as the nature of peer support is, it's mutually beneficial for everyone involved. So that's just a bit of my background as well. And I'll just pass it off to Brendel.
Hello, everyone. I just want to put a disclaimer out there. My internet is not the best, so I really apologize if I lag or cut out. But I'm very happy to be here today. My name is Brendel Mitchell. Was born and raised in Montgomery County. I'm 25. I graduated from Towson University in 2018 with my bachelor's in sociology, anthropology, with a concentration in criminal justice. I was diagnosed with depression, anxiety, and I have been in therapy ever since, and I love it. It has inspired me to become an advocate, and the struggles that I've gone through and overcome have inspired me to take on this peer support role that I am currently in with Haley. So that's just a little bit of, and through the questions, you all will learn a lot more about us and our experiences.
Thank you all so much, and I'm so sorry for my technical difficulties on my end here. But I want to go into some questions, and again, folks, feel free to put questions in the chat. I think this is a great experience for all of us, because I think in the community of primary care and mental health care, learning from folks with lived experience, and actually being a partner together is so important. So I want to kind of first go into some questions about if you can share about a negative experience you have had with a healthcare provider.
So I'll take that one first. So my answer for that one is a little unorthodox. So I want to say, speaking of, I don't want to say outright negative experiences, but I will say the experiences I've had being in a doctor's office weren't positive. I often felt like I was just another patient. I didn't feel very seen. I felt like the doctors were always in a rush. And it just felt very routine procedure. I wasn't very comfortable to when it was time to answer questions or talk about what's going on. I didn't feel that comfortable really opening up and talking about something. Just feeling like another patient. It didn't really feel like I mattered. And that sounds, I don't want to sound dramatic, but that's how it felt. And going to the doctor as a child, even now, is intimidating. So I think that lack of comfort and security and feeling not seen would be my bad experience.
Yeah, and I think what comes to mind for me is several different experiences that I had at different points in time. When I was really young, I think for a long time when my symptoms of anxiety were really starting to show and manifest, I think it was perceived by most of the adults around me to just be extreme shyness. So I do remember having several doctor's appointments where I would go in and after, talking about this with doctors and therapists and psychiatrists since then, I can now see that they were panic attacks that I was having when I was in the doctor's office, but it was never brought up to my parents that this could have been a manifestation of a mental health challenge. It was more so seen as like, she's uncomfortable here, let's just get her out the door, she'll feel more comfortable at home. And I don't think it was really a part of the conversation that it could have been anxiety or, something more severe than just a reaction to my environment. And then another experience comes to mind when I was a teenager and I was really trying to form a frame of reference when it came to my mental health because I wasn't sure for a long time if what I was feeling was worse than my peers or, if this was something that we all go through. And so again, like Brendel said, I was afraid to bring things up to authority figures in my life. And I think when I was at the doctor's office, I felt like, oh, I'm just, they know it all. They're the professional. I don't even know what I'm talking about. But I finally got up the courage to say, like, I'm feeling some really low lows. And my mind is just like always just filled with these intrusive, really negative, awful thoughts. And at the time, it was really sort of brushed off as you're a teenager. This is hormonal. This happens to everyone. And the next steps that were established was, if this is still a problem, next time I see you, we'll talk about it again. But I think, at that point in my life, I wasn't going to the doctor that often. So the next time I saw them would have been like a pretty decent amount of time in the future. So a more recent experience that I had that I think I would categorize as a bit negative is at this point, I had been on medication before for anxiety. I went off of it and I was doing fairly well with therapy and alternative treatments. And I was considering going back on anxiety medication. And I got a new doctor because I moved to a new town and I was just sort of like getting everything set up. And I still have a bit of a fear when talking to doctors, but I'm a much more confident self-advocate now. And I really was psyching myself up to say like, okay, I want to try medication again. I'm going to introduce this to my doctor first, just to like put it out there. And she looked at she gave me a screening for generalized anxiety disorder and depression. And I was discussing my results with her because they were high. And I told her that I did have these diagnoses. And she was like, "Are you on medication?" And I said, "No, not right now." And before I could continue, she said, "Oh, good." And that to me completely squashed all of my confidence in trying to bring it up to her. And I ended up not bringing it up that day because I just felt sort of defeated. So that was one of my more recent experiences with a primary care provider.
And Brendel, you said you had one more thing to add about this question. She might be having some connectivity issues on and off, so she can chime in. She gets reconnected here. So on the flip side of that is, can you share about a positive experience that you've had with a healthcare provider or a primary care provider?
Yeah. Oh, Brendel, it looks like you're back. Did you want to start with this one?
Yes. So positive experiences I've had, the most positive experiences I've ever had were the doctor coming in, whichever doctor I was seeing, and just their body language was so important to me. And I didn't realize how important it was until I reflected on my experiences. But just they're facing me, they're looking at me. They're not just hovered over their computer or writing and not even looking at me. Asking intently with follow-up questions, looking me in my eye like, "Are you sure?" Like just trying to gauge a little further and not taking what I'm just giving on the surface for just that. I think that just the complete opposite of what I was experiencing or trying to explain before. They took their time, they asked questions, and I was left feeling like they genuinely cared about me and my well-being, and that my time with them was well spent. They made me feel safe, and by excuse me. I mean by feeling safe, providing, not talking down to me.
I think I can go ahead and jump in just until Brendel gets back. One of my more positive experiences happened recently, and I think it's in part due to the fact that, as I was saying earlier, I do feel like I am a more confident self-advocate now when I'm in a doctor's office or when I'm talking to, a psychiatrist or something like that. And I think my most positive experiences are when I feel like I have a true ally in the room. It's not someone who's like, trying to sway me in any one direction. They really hear what I'm saying. And, I do take the time, I think, to really explain, like, I've tried this in the past and this was what happened. And I tried that in the past and this is what happened. So I do think part of it is because I do make sure to assert like my position on certain things. But then, like, of course, I'm not a doctor. There's plenty of information that I can get from them that I never would have thought of otherwise. So it's really important when I feel like we're partners, when we're creating a plan for like what my next steps are, rather than someone telling me what to do. Sorry, Brendel, you can go ahead and finish up.
Where did I cut out?
I think right about when you were saying you felt heard, you felt seen.
Yes, like there was, I think that we can wrap it up there. That pretty much was getting to the point.
Thank you. Interestingly enough, I was just on a training this morning and something really resonated with me, which I felt like I heard both of you sort of say, was that I think the acknowledgement that there are always two experts in the room you know, your physician or primary care provider is an expert in medicine, but you're an expert in your own experience, right? So it's both of you together who are both experts. It's just you're experts on different things. So the next question is a little different. So taking flight offers peer support, and I was hoping that you could kind of go into that a little bit and define and describe what peer support is and why a primary care provider or practice might want to refer a patient or family to a program like Taking Flight or Maryland Coalition of Families.
Yeah, I think when it comes to peer support, as funny as it sounds, it's sort of a hard sell when we're describing it sometimes because it is such really a simple concept with such incredible benefits to it. And really, peer support is just someone using their personal experience, what it's like to live and thrive with a mental health challenge or if they have a substance use disorder. And you're really just supporting someone else's progress towards what I like to say like is a self-determined life. We share information, resources, real stories of recovery, like tangible steps that have helped their peers that they could either incorporate into their life or just, when we open up these conversations, it's a lot about feeling less alone in your experience, which can be such a significant step for someone, as well as, talking about what worked for someone, what didn't work for them. And, it's really helpful to have those conversations before you dive in sort of blind, because a lot of times you don't really know which way to turn at first. And so having a network of peers, supportive people who have maybe been in a very similar situation in the past, they can give you some direction. Even, as I mentioned earlier, even saying, hey, this didn't work for me, and let me tell you why, that can be helpful in someone deciding what their best first step is. Brendel, I'm sure you have something to add to that too.
I wrote a little bit in the chat just in case with this internet. But I just wanted to add that peer support is also great for those who are not super into therapy or who are having trouble accessing therapy. Can you still hear me? Am I going okay? Okay, yes. Just have to check. There's also, like Heather, I'm so glad you mentioned this earlier, like so I am biracial, Black and white, and in the Black community, like we're still having a lot of difficulty accessing mental health care and having the appropriate and accurate education.
Again, I'll just jump in real quick while Brendel's loading. I think Brendel was touching on, it can be an excellent addition to, if you're going to therapy, if you have a psychiatrist, because we do something that I actually heard earlier today that really resonated with me is, sometimes you need a fixer, which could be like your psychiatrist, your doctor, and sometimes you just need to be heard. And I think that's sort of where we come in. And having those two things working in tandem can be exponentially helpful. Brendel, you're back.
Oh my goodness, I'm so sorry about this, everybody. What was the last thing I said?
Education not being available.
Yeah, so just wrapping up on what you said, this is a great way for people to establish a support system, especially those who lack a support system at home or are just new to getting mental health care in this way. You really feel like an equal when you get peer support. With a therapist, I love therapy personally, but some people are uncomfortable and they don't feel like it's an equal relationship. But they want the help, and we can offer that. And so can our other family peer support specialists.
Thank you. So kind of going off of that a little bit, how can young people be more involved in making decisions about their healthcare and mental health care treatment?
I think most young people, at least in my experience, aren't aware that they have a say in their mental health treatment or their, physical health treatment. I think, obviously when you're really young, you don't always have the vocabulary to, articulate how you're feeling. And that can be really helpful to have like a doctor or a parent or someone who's really supporting you in that journey to help fill in the gaps. But once you learn that you do have a say and you really do have to advocate for yourself in this space, I think that a lot of us think growing up, like, oh, I see a doctor and they can look at me and they know exactly what's going on. But like they need you to provide them with some cues. Um, and once you do that, that's when you really start building that voice. And then you can start, better describing your needs. And I think that something that we do is to empower each other and help each other become better self-advocates is, stories of recovery, stories of other people being that strong self-supporter. And also, we provide services like if you need us to run through how a phone call might go with you to practice, if you need to hear of a time that like I've had this conversation with this type of person, we can practice, we can join the call with you, things like that really to just like make people feel safe and comfortable when they do get to a point where they feel like they need to be heard.
And say that it's really about, am I here? Can you hear me?
Yes.
Okay. It's really about empowerment. Young people need to be educated and empowered to speak up for themselves. I think we often feel like like Haley was saying, like we don't have a say in our treatment when that's not the case. I think it's also the responsibility of healthcare professionals to um, to say that you have autonomy in your treatment plan. What you want for yourself does matter because it does ultimately.
Such a bummer that she cut out while saying that. Oh, there you go.
You're back.
My back. Well, where did I cut off?
You said that your autonomy matters, and it's our job to make sure that that we have made young people aware of that.
Yes, we put so much pressure on the patient when really it's the healthcare provider that needs to do the work to be educated, needs to do the work to make the patient feel comfortable, needs to do the upper leg. You're the professional, so I think we have to empower. As I think what medical professionals can do is empower young people, empower your patients to use their voice and advocate for them. For example, as I've grown up, I've kind of gotten more of a holistic approach when it comes to treating certain things. But I've felt shame from doctors before because I voiced that. Shame is like not how you're going to actually treat anybody well or help anyone. And I think people often feel very shamed. That's an issue I think I hear about a lot and that I've experienced a lot. So education, empowerment, autonomy.
That's amazing. And not to share your business, Brendel, but I think that means you're going to make a great social worker. She just got into Howard University to their master's in social work program. So I'm really excited because that's so important as a social worker, the aspects of self-determination and empowerment. So that's amazing. So some of these questions might be a little bit more and we reviewed these before, so you all said that these are fine. So, but let me know if they're not. So can you both remember what it was sort of like when you were first experiencing struggles with your mental health when you were first diagnosed? Kind of what was going on and what made you kind of first recognize you were maybe kind of struggling or something was maybe off?
Sure, I can go first.
Sure.
For me, it was in high school where I started having a lot of difficulty getting out of bed and getting to school on time. I irrationally angry. I was crying all the time. I went through something. There was a trigger to that, but it wasn't just this lasted a week or 2 weeks or 3 weeks. This was happening. And I got to a point where I was scared. I was scared about what was going on in my head and how I was behaving and what I was feeling. And beyond that, I didn't understand it at all. Parents things, looking back, I don't know why, I wish I did, but like I was so terrified to the point where I actually went to, was that scared. And that's kind of where my breaking point was in getting in that first step, getting myself mental health help. I was just scared and I was not, and it was
I'll just jump in really quickly. So for me, it would manifest in ways that I would have a complete overreaction to things. I was very, very hypersensitive. And I think it was really pointed out to me at one point. I had like a minor fender bender in my car when I was like 16 years old. Neither car had a mark and everyone was fine. And I went home and I was telling my parents about it. And I had a panic attack and I couldn't breathe. I couldn't get the information across. And I remember my mom saying something to me like, there's got to be something else going on because I don't see how this could be upsetting you this much. What else is going on? And I had no idea. I had no idea what was going on. And that was, as Brenda was saying, really scary. I just felt like there was this like crushing weight on my shoulders. And I couldn't point a finger at any one thing that was upsetting me. I was just so unbearably upset. And it was just triggered by something really minor. And I think that was one of the first times that it was really brought to my attention that, how I was feeling about this isn't how maybe someone else might be feeling about this. And that, in addition to when I was growing up, my household was very, very volatile. Like both of my parents really struggle with their mental health, and they both also have substance use disorders that they are still working through. And I very much thought that how I was feeling was a reaction to my environment. And I was like, oh, as soon as I leave this environment, I'll feel fine. Once I go to college, I'll be great. And then, I got into college and I moved out and I still felt the same. And that's when I really had to come to terms with the fact that this is coming from me. Oh boy, like here's something that I have to really look at in a completely new light now. Brendel, did you get to finish?
pretty much finished.
Okay.
Yeah.
Okay. I think you both do a good job of picking up when the other one, has a connection. I think it's like pretty good. The flow a little bit, it's pretty good. So thank you for sharing that because I know it's a very personal, it is a personal question to ask that. When you were first recognizing that you were maybe struggling with your mental health, did someone else recognize that as well and reach out to you, or was there someone, there to offer you support or offer you any guidance?
For me, I want to say the bulk of it was me. But I will also say my parents noticed a difference in my behavior. The issue was that they didn't realize the seriousness of it. And it took me coming to them for things to start changing and me getting like real help. So it's a little nerve-wracking to think about because what if I didn't come to them You know, they didn't recognize the signs, and they didn't know how to essentially what to do. So I would say it was on me, really.
I think also, I would have support from my friends and my sister in that they would say, I really care about you. I feel like you should talk to someone about this, but in a way, I feel like superficial isn't the right word, but it was very on the surface. It was like, this is your problem. You should figure it out. We care about you, but you need to go do X, Y, and Z. And that's very much, what it is. It is your own journey, and no one can do that work for you. Um, but I didn't feel like I really had a support in place that could, like a safety net. Like I didn't feel like I had, someone who I could ask to join me on, like I'm going to my first psychiatrist appointment ever. Will you come with me? I didn't really have like that sort of support. But I do think that would have been really helpful for me at the time. And I think additionally, coming from a household where my sister and I felt very much like we parented our parents, we held a lot of responsibility at a really young age. And I think by the time I got to the age where it was, I've heard this phrase a few times and I really like it. It's that your mental health isn't your fault, but it is your responsibility. By the time that my mental health was my own responsibility, I was tired of it. I was like, I don't want any more responsibility. I'm done. And then it really just felt daunting. And I think if I had had someone in my life to sort of lift me up and get me to a place where I felt good and like it was right to go get treatment, that would have been really helpful. But I don't think I had it at the time. But that is what attracted me to taking flight, because I always say that we're here to provide the supports that I wish that I had had when I was younger.
And I think, Haley, that's so interesting because our parental situations are very almost opposite, yet we still experience something very similar with that feeling like it was kind of on us
Yeah.
to do something, you know, like people would joke around in high school and be like, why you always look so depressed all the time? And I was like, oh, I am.
Mhm.
Okay.
Were there any other like challenges when you were kind of realizing I mean you all mentioned a lot, so if you've exhausted, like I don't want to exhaust this conversation of like, oh, there's so many, but were there other challenges like because I'm assuming both of you might have been at school at the time, like was there any challenge with your school or trying to get help through your school, or um any other things with friendships or other peers?
I will say that I had zero to no faith in the school counseling department at all. Like, just being honest, like, at all. They were not a safe space for me. I didn't feel like they were on my side. Um, they were not someone I considered going to. And I think that is very sad. And I think that I don't know what it's like now in schools with the school counseling departments, but I wasn't in high school that long ago. So um, it felt like the school counselors were there on behalf of the school, like liability versus actually caring about the students. Um, I don't think any of my teachers ever noticed anything about me. Um, no one knew anything really at all. So sad to say, but that is the truth for my experience.
I think I was very, very burdened by the stigma that's associated with mental health, especially when I was in high school and I was starting to really try to figure out what was going on with me. And, I think things are a bit different now, but even like the vocabulary used to describe mental health and, what that meant for you as a person wasn't great. And, high school is hard enough as it is. And then as I got to college, I feel the same way. We had a counselor on campus, and I did reach out to them. And I think this is pretty common. It took about 6 weeks for them to get back to me. And I think, at least in the state of Maryland, I want to say on average, it takes like 6 to 8 weeks for someone in a counseling center to get back to you on a college campus. And to me, that already was like, it took a lot of mental gymnastics for me to get to the point where I could walk into that counseling center. I had like an episode of self-harm beforehand, which is really what pushed me to go. And then I didn't hear from them for a really long time. So it was almost like, when you're in crisis, you need something pretty right away. And even like additional support, like for the Taking Flight events, we always make sure to let everyone know who's participating that Brendel and I, we're not crisis counselors, we're not licensed clinicians, but we are there to meet them where they are and support them. And I think even if I had had that at the time, it would have soothed me at least a little bit. But yeah, it took a while. And because I think the reason why it took me so long to get up the courage to, walk into a counseling center is because of the stigma. I didn't want the label. I didn't want this to be something that was assigned to me. I didn't want people to see me walking in there, things like that. And I think as far as friendships, it sort of became a source of resent in a lot of ways, because I think my friends wanted to be helpful, but there's a big difference between being stressed out because it's finals week and having like crippling anxiety. And I think like their intentions were really good and they wanted to be there for me and support me. But I think at a certain point, your friends are like, I'm tired of hearing you say this over and over again. Like, why can't you just be in a better mood? Why can't you just this and that? And that's where you need a professional really to come in, or a peer who's been there to say, your feelings are valid. We don't think you're just like a negative Nancy. Like, we do value you, and this is just something that you're struggling with. So I think I'm at the point now with my friends and family where we have very open conversations about mental health, because I really do sort of push that agenda of like breaking down the stigma. But for a long time, it really did impact my relationships with my friends, my family, everyone.
I will say the same exact thing. But you inspired me to speak about how, especially in high school, I went through a lot of trauma and I had a lot of personal issues. And it led me to eventually be in a physical altercation my senior year before I graduated. And instead of them sitting me down and truly asking me, like, what is going on? You've never gotten in a fight ever. They recommended me to get expelled, suspended me for weeks, and I never got in trouble before. So, that's the treatment a lot of students of color get. It's no, what's really going on? It's let's just punish you. And I think that's something also important. I want to make everyone aware of that happens so much. Had I had gotten teachers or counselors actually paid attention, they would have seen that I was in an emotionally abusive relationship, and I was getting bullied and these other factors that were going on. So I just wanted to add that part in, and also fully agree with what Haley said. I've lost friends, I've lost a job, I've lost a lot of things because of my mental health issues. 100%.
I appreciate you both being so honest and open about these things, because I know it's not easy to talk about a lot of these things. And I think you're right, like stigma plays a huge part in this. People don't want to always reach out for help because the response they get can be quite jarring and even re-traumatizing. Someone was even talking about today, I saw a comment about, when you get EP'd to the emergency room, that can be a very traumatizing experience because it often involves police. And for many communities, that's very, very traumatizing, and things like that. So like how do we get people the help they need so they're not feeling they can't even reach out? Yes, I think these are important points.
And something that we bring up a lot too, to add to that, is like we advocate for more and improved community resources available to young people. but it's a dual issue because, you know, once the community supports are there, if the stigma still exists and no one is, you know, benefiting from the supports, then what's the point? So it's like we always have to fight that stigma and, you know, promote an anti-stigma message because we want to build these supports and we want people to access them when they're in place.
So it seems like both of you have made a lot of different changes and have had a lot of growth, you know, since kind of maybe realizing you were first struggling with anxiety or depression or ADHD. And I guess I'm wondering if you could comment on what some of those changes have been, whether internal or like external changes.
So for me, one of the biggest factors was the fact that I got into therapy. Therapy changed my life, but it wasn't until I got my second therapist.
I'll just hop on real quick. I agree with Brendel. I think, and I believe she'll probably be talking about this when she gets back on, but the process of shopping around for a therapist is very daunting, I think. You know, it takes a lot to see one, and let alone figuring out that maybe it's not the best match. And then you have to sort of start the process over again. That can really take a lot of energy. But Brendel, since you're back on, I'll let you go ahead and finish.
Taking me through a loop for this internet situation.
I'll just, oh, there you are.
Can you hear me?
Yes.
Sorry, this internet is ridiculous. So you said the question was, what changes have I made externally and internally? Okay, so I was gonna say it started with therapy, but that's really for me where it started. The therapist and going to therapy is ultimately where I learned the tools to help myself internally. Um, no one else was teaching me these things. That the therapist for me was completely helped me get accommodations for myself in college, for example. My therapist helped me not get a failing grade in courses because I was able to get a medical withdrawal. Without that, I would have just tanked college essentially. So those are a few examples. Internally, the internal changes that I made came now. I wasn't able to make those internal changes when I was in high school. It's come from years of going to therapy and going through the same cycles and unlearning and learning, and it's just been a lot. So some of those internal changes that I made are I've become more spiritual, for example, yoga and meditation, the law of attraction, all of these things I have learned from therapy, I will say. But I've also, am I still good on the internet? Can you still hear me?
Yes.
Okay. Woo. A lot of these other internal changes I've made all come down to my mindset, how I think about things, how I frame things. But I keep going back to a therapist because that's just my truth and my story. Like, I could not have gotten where I am today and overcome the things I have without my therapist and everything that she has taught me. And she's given me the tools, but I'm the one doing the work. I don't know how helpful that is because I know a lot of people don't have the same access or the same positive experiences with therapy. But that is what I can offer. I'm a huge fan of therapy. That's been the biggest life changer for me.
I agree with that wholeheartedly. And I think as far as my external changes, this is something that I am still sort of working my way through to get to a point where I'm okay with it, where I'm noticing as far as work and employment, I have a really, I have anxiety, and I'm noticing that I might not be able to work 40, 50 hours a week like my peers are because, excuse me, because my anxiety would be so high that I would be completely non-functioning outside of work. I would have been completely used up if I had a full-time job like that. So I have chosen part-time jobs in favor of my mental health because I just feel like, yes, I wish I could be as high achieving as them, but at the point that I'm at right now, I see that I need to be balancing this in the way that works the best for me. And at times it makes me feel bad because I was like a high achiever in school and that was very much related to my anxiety. But now like I see my friends excelling and they're in these positions that like I would like to see myself in, but I just know that for me right now I have to keep my mental health in mind because I'm only hurting myself if I completely burn out and run myself ragged. So that's something that like is external. I've had to choose jobs that I know will be less strenuous on my anxiety, and that like plays into how many hours I'm working and things like that. As far as internal changes, I really am, shifting the focus for the longest time, as I mentioned earlier. I was really just focusing on my parents and their mental health and like making sure they were okay and taking care of them and really just like trying to be this as supportive as I could be towards them. And it took me until honestly fairly recently to shift the focus to my own mental health because you can't really help anyone else unless you are your best self. So I think even though I've heard that, a million times, like you can't pour from an empty cup and all those, and I know that, I understand that, but I didn't practice it. And it's very much a practice. I'm like still on that journey, I think. And once I shifted that to my own mental health, I saw that I was a better daughter, a better sister, a better friend, a better employee because I focused on myself. And it took a lot of convincing for me to figure out that that's not selfish, that's necessary. So I think that's my biggest internal shift right now is focusing on myself and not feeling bad about it because it just will positively impact every other aspect of my life.
Thank you both for that. And I would argue no one should be working more than 40 hours a week. I don't care who you are. Um, but let me get off my soapbox here about that. You'll need rest. But going back to the therapy part, and please, folks, please put in some questions if you would like, because we only have about 8 more minutes left. Luckily, though, we did have Haley and Brendel did write the newsletter for this month, so that will be coming out in a couple of weeks towards the end of April. So you'll get to kind of see more from them in that newsletter. But I want to question about sometimes we get on our in primary care warm line, and we'll have, or I mean, I guess it would be teens and other patients who are, youth, young adults who might be resistant to try therapy, even though their prior doctor has explained the benefits and has encouraged the client to seek that treatment. And I guess, is there a way that the care provider could help the teen or young adult be more open to that, and open to that? It's beneficial for you. And I think I hear that sometimes, like, people just don't necessarily, there's some there, I think that there's not reasons for that, but
Yeah, I think what I have to add to that is therapy it doesn't look the same for everyone. It's not just one thing. You're like, when you walk into therapy, it could look like you having homework from the previous session and you talk about things written in a workbook or journal. You could be doing CBT. Or, you know, therapy could look like you just like entering that space and knowing that you have someone that you can bring a certain issue up to, but you don't even need to, you know. There's like a really famous story that I keep here that is being told, where, you know, it was for a young child and they were really resistant to therapy. And so they sat down with the therapist and the therapist just gave them like pencils and paper. And they were like, the child was like, I'm not talking to you. I don't want to talk. And the therapist just said, okay, here's some materials. I'm here. If you need to open up, let me know. And the conversation sort of flows organically from there when they feel comfortable. So I think all of that to say is that I think a lot of young people have a preconceived notion as to what therapy is. It's like you're laying on a couch and there's someone with a pipe, I don't know. But it can be so many different things. And I think you can really tailor it to your own needs.
Can we hear me?
Yes.
Okay, I wrote out a message just in case, but I think it would be helpful if they're resistant to therapy. Let's talk about your concerns with therapy first without trying to tell you you're wrong. Let's validate your concerns. Let's present the facts. Let's have a little bit of education. And then from there, let's find some options that are outside of therapy, because there are other options. And we can get to therapy at one point, but it's never something to be forced down someone's throat. And I think we need to be more realistic with people. Like, therapy is not comfortable, like, most of the time. It's not, because healing is not comfortable either. Just like the example of when you scrape your knee, like, it's gonna hurt, but the hurting is the healing. So I think it's important to not patronize people and let them know what to expect, validate their feelings, and then present options for therapy, because therapy isn't always talk therapy with a therapist. There's art therapy, there's music therapy, there's exercise therapy. There's so much you can do. There's peer support, like what Haley and I are here to do. There's so many options, and I think being aware of those options and letting people have options is like the best way to go.
I think you definitely nailed it when you said that, you know, healing, it takes a lot of work and it's really uncomfortable, and sometimes it can trigger you in times when you really just want to forget it and not put the spotlight on these things. But I feel like it's important to be as honest about that from the start as you can be. And if that deters someone from going to therapy, you can say, as Brendel was saying, like, that could be the end goal, but look at these things that we can do in the meantime that can build up your confidence in going.
Since I don't have any questions in the chat, one last question before we wrap it up is kind of a similar question along the lines of medications as well. How would you suggest maybe because that's another, I mean, that's one of the biggest calls we get to on the physician warm line at BHIPP is about, you know, physicians might want to talk to one of our providers about starting a patient on a medication. And, you know, not everyone some people have great experiences with medication and some people have really bad experiences with medication. So how would you want to be talked to about medication as a young person, or how would you kind of maybe like ask a primary care to maybe consider talking to a young person about that?
Yeah, I think I have a pretty relevant experience. So when I was young, like just entering high school, I experienced one of my parents misuse a prescription that they were prescribed, and it caused a substance-induced psychosis, essentially. And it was an antidepressant that they were prescribed for depression, and it was just in the way that they used it, which was inappropriate. It caused this really adverse reaction. So I thought that's what would happen to me if I ever went on medication. I was terrified. I thought it just was like this awful thing that would completely change my brain. So I was terrified of it. But then I did get to a point where I was like more open to it. If used properly, it can be really helpful in a lot of ways. And so I introduced that to a doctor that I had at the time, and I think it was handled really well. It was just like, this is something that we can try. And it does take a few weeks for it to kick in. Don't expect, instant results. And it is something that we can meet up again, talk about it, and switch it up if this isn't the one for you. I was under the impression that you get prescribed one thing. If it doesn't work, you're kind of a lost cause. But I was introduced to the idea that there's a lot of different options and they do have nuanced effects on people. And that everyone, I think biologically is different and they could be more helpful or less helpful. And it's a journey that my doctor was committed to joining me on. I'll be with you every step of the way. If it doesn't work, let me know. We will figure this out together.
Yeah, and I think it should start always as a conversation. Let's just talk about this. Let me present you with the information. Let me let you know realistically what to expect from this. Let me let you know that you have the option to, refuse this. It's giving that reassuring that this person has autonomy no matter how young they are. They deserve that. For me, I do take medications, but I'm not the biggest fan of medications. I would rather do something more holistic first and then see what we can do. I think, like what Haley was saying, it's about let's go on this journey together. Let's figure it out together. You tell me from a doctor's standpoint all the information you have. I tell you my concerns and what I'm feeling and not feeling, and we'll figure it out together. But don't tell me I need to do this, because that's just gonna I'm just gonna be either scared or offended. So let's work together. Some people definitely 100% need medications, depending on what the diagnosis is. And I think that we need to be realistic when we talk about that. Okay, the science is showing that most people with this diagnosis, they live a lot better. They have they have higher quality of life by taking this medication, and they will most likely struggle less. So presenting it like that without saying you have to do this, but if you do, chances are you'll be better off. So that's kind of my feelings about it. I hope that helps.
Yes, thank you so much. I think this has been a great experience for all of us, and I really appreciate you all, sharing, being so open and honest, because I know that it can be a lot for us to ask you to please tell us all about your experiences and everything like that. Let me see if I can share one last time the slide with your information and not it be a big technological mishap before we go here. So
yeah, and I'll even put my email in the chat. And as Heather said, we did contribute to the newsletter that is coming out later this month, so that will have our information as well. And yeah, feel free, if you think of any questions, email us. We're very open to talking over email, calling, Zooming. We love to use our stories for advocacy. We love to, try to get as much people to benefit from peer support as possible.
I did it. So yes, here is how you can keep in touch with Taking Flight and all of the great work that they're doing. So thank you so much. Please look out for the newsletter, and our next resilience break will be in May, and it is on race and kids.
Oh no, now we lost Heather. Thanks again, everyone, so much for letting us share our stories today. It really means a lot.
Thank you so much for being here.
Thank you.
Take care,
Thank you.
everybody.
Bye-bye.